Is your heel so sore from acute plantar fasciitis that you can't even put weight down on it anymore, and you can't wear your orthotics and your arch supports to get it better? Well, I have some alternatives that really work in lieu of your orthotics or arch supports. So please stick with me and I will share them with you. Hey everybody, I'm Dr. Gaffney from Dr. Gaffney Best Foot, here sharing tips and tricks of what has helped my patients over the years in order to save you time and money in your foot care decisions. So acute plantar fasciitis can cause a lot of inflammation around the heel pad and can also cause bursitis, where you can't put your heel down to bear weight and you limp and you can't tolerate your orthotics. So I have some alternatives to share with you. And this is all part of a whole treatment plan that your podiatrist has in place for you or should have in place for you. So this is just one piece of the whole treatment plan. So please check out my episodes on how to resolve plantar fasciitis, and I'll have a card here for you to click on those previous episodes. It gives all the treatments and explains everything. But make sure you're following with a podiatrist or healthcare provider as you try to navigate your way through plantar fasciitis. You really need someone in your corner and someone helping you with these problems. So one of the important things is support of your plantar fascia as it's trying to get well. And sometimes, like I said, it's just too sore to tolerate those orthotics. A lot of times what I do in this case is I will put the patient in a cam boot, which is kind of like a cast, and get them in crutches and have them offload it in order to allow that plantar fascia to heal. However, a lot of patients cannot do that. They have jobs they can't take time off of. They can't wear cam boots to their job site. They're busy parents. Their lifestyle just won't allow it. So in this scenario, I have some other alternatives that help support the plantar fascia instead of that rigid arch support, just to help to get through that inflammatory phase as the plantar fascia is trying to heal. Okay, so the first supportive device is this Mueller arch binder. It's sort of like it's a brace, but you can get a pure arch binder, which is just like elastic band around the midfoot, and I like that the best. But I'm going to show you how this one works. Okay, so this is the Mueller arch binder ankle wrap here. So the arch binder, it goes, it rolls out like that, and then you put that up into the arch, and you want to roll it around like that and up really tight that way, so it'll lift the plantar fascia off the insertion site there, and then around like that, and then you just hook it. But you need it real snug up that way to support the ligament there and keep it off the heel. So this is $10 at Walmart. All right, so the second device helps when you have tendonitis on top of your plantar fasciitis, as if it could not get any worse. But anyway, as you limp and you turn your foot to offload the inside part of your heel, the posterior tibial tendon can get very inflamed, and next thing you know, you have tendonitis. So this next device, it's called a ASO ankle brace. It's Donjoy, and I got this at Walgreens for $40. Works very well for that. Ideally, I have my patients offload with crutches, like I said, in the cam boot, especially if they have tendonitis on top of the plantar fasciitis. But many times patients just cannot do that, and so this would be the next best thing. And I will show you. Here it is out of the box, and I'll show you how it's used. It mainly is used primarily for ankle sprains, but it's like a little lace up here with the straps that go around and up. And it really does great to support the ankle for ankle tendonitis, and also lift that plantar fascia to keep it from pulling at the insertion site on the heel bone. So I'm going to show you how to put it on and how it works. Okay, so I have it all laced up, and so you want to take this long strap right here, and you take it around the front, and you're going to pull it super tight this way. And there's Velcro, it sticks right there. And that'll support the posterior tibial tendon that's irritated. And this band will lift the plantar fascia, take the strain off the insertion site heel here at the plantar medial heel. And then this other strap here just goes crisscrosses in front of the ankle, and then you pull it up on the side, not as snug. This one on the inside is the important one that takes the strain off the tendon there and off your heel. And then these two just kind of hold everything down so they don't flop around like that. Okay, I've got one last great tip to share. But if you are enjoying this episode, if it's helping you, then please hit that like button. I'd appreciate that very much. And thank you so much for watching. I appreciate that very much as well. So the last technique is an arch strapping. And so it's basically athletic straps up in the arch with the U-strap. I've done an episode on how to do this yourself. So I'm going to leave that card for that episode that you can click on and see how to do for yourself. And it's very effective. And I use it as a test to see if someone will tolerate a rigid orthotic. So if you do really well with that strapping, that usually means you're going to tolerate a rigid orthotic as well. So please check out that episode. And lastly, I encourage you to work with your healthcare provider, your podiatrist, in getting your plantar fasciitis better, especially if it's early onset. It's really key to follow every point of the treatment plan to get well and be persistent with it. Please check out my episodes. I go through all the different treatments, and I'll leave the playlist card for you to click on to check that out. Hey, thanks so much for watching today. If you learned anything or if I've helped you at all, please like and subscribe to my channel, and please leave me comments and I'll answer any questions that you have. If you have any topics you'd like me to cover, please leave that in the comments as well, and I'll do an episode on that in the future. And thanks so much. We'll see you next time.
Please see the full disclaimer in the description. This is not a doctor-patient relationship. This does not constitute medical advice, but is for informational purposes only.